Laughing gas was not working for me. Gas in air was not working for me. And all I kept screaming was, epidural please, call the doctor, epidural please. Yes, I'm not going to tell you lies. This is just my experience when it comes to pain. Personally, I have low threshold for pain, and I'm glad epidural was able to help. Good day everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. Today, we're going to be talking about epidural as a method of pain relief during labor, and I'm going to be answering 16 questions in regards to epidural. And these 16 questions are going to be based on my personal experience and also my knowledge as a midwife. So if you are a first-time mom or you are a mom that is planning to use epidural in your next childbirth, this video is for you. It promises to be interesting and exciting. Let's not waste any time further. The first question you're going to be asking is, what is epidural? I'm going to tell you. Epidural, you can see that as a local anesthetics or a painkiller. Yeah, it's a local anesthetic or a painkiller that is administered through a fine tube in your back. So whenever you hear epidural, just know that they're going to pass a fine tube into your back, and it's that fine tube that's going to give you that pain relief, that's going to make you feel better. Okay, that takes me to the second question number 2, and that is, why do they use epidural during labor? I'm going to tell you. They use epidural during labor because it numbs the nerves. Yeah, it's the nerves that send a message to the brain. There is pain. Scream, scream, scream. There is pain. But what epidural does is that it numbs the nerves and help you feel better. It numbs the nerves so you don't feel that pain. So when they give you this medications through that fine tube, it's going to make the nerves sleep. The nerves are going to be weak. The nerves cannot pass the message to the brain, like transfer those messages fast and say there is pain. So epidural is a good way to actually stop that pain, to actually block that pain. The painkillers used in epidural, guess what? They could be local anesthetics, they could be the opioids, a smaller dose of opioids, or a combination of both the local anesthetics or opioids. So it all depends on the anesthetics, the amount of pain you are feeling, and the state you are at that particular moment. Okay. Then the third question is, how is epidural given? First of all, from my own experience, the anesthetic comes, they tell you everything you need to know about epidural, they tell you the side effects, they tell you the possibility of having a long-term effect, they explain everything to you, and they give you a form to read. And sometimes they may ask you to sign depending on your state, but they just want you to know the do's and the don'ts of epidural and also the side effects and everything attached when it comes to epidural. After that, they get their whole table ready for the epidural procedure. And when they are close to you, they tell you to bend. Your caregiver is going to help you stay in that particular position. It's going to tell you the position to be in. So you cannot lie on the bed to have it. There's a particular position. They coil your back, okay? And they try to find what they are looking for there. They know what they are looking for. The anesthetics know what they are looking for. So when they find it, they put the epidural tube into the back via a needle. So it goes in and they administer whatsoever painkillers they want to administer through that tube. And also, this whole procedure takes 20 minutes to take place, and also the action takes 20 minutes. You start seeing effects like within 20 minutes. But me, I started seeing the effect of this painkiller in less than 20 minutes. And when they pushed it inside, I remember the anesthetic asking me, "Oh, Mercy, did you feel any electrical sensation on any of your leg?" I actually felt it, and that was a good sign that it's going to work. So I was super excited. So that's how it is being administered. But in some NHS trusts, there's something called the spinal. That is for another video. The fourth question is, are epidurals suitable for everyone? I would say yes, but there is a but. There is a but in the sense that if you have a high BMI, if you have blood clotting issues, and if you have a history of back pain, it is very important for you to discuss that with your anesthetics. High BMI, blood clotting issues, and also back pain, please and please, it's very important for you to have a proper discussion with your anesthetics. Then the fifth question is, how are women experienced with epidural? For this question, I'm going to be sharing my personal experience with epidural. With epidural, I felt more relief to actually push. Yes, I felt like the pain was all over. First of all, I was having severe contractions. I was having contractions back to back. They were coming, but the gas was always knocking me out. So with the epidural giving, I felt relieved. There was no pain with the epidural. So after the epidural, personally, I rested. Like, I got a lot of strength. I got more strength after the epidural. While my contractions was going, I kept on dilating, like it was moving, the dilation was going. So when it was time to push, I felt like I have all the strength necessary to push. And when it was already 10 cm dilated, it didn't really take me 15 minutes and the baby was already out with the epidural. So I could feel a pressure because I wasn't topping the dose of my epidural. So whenever I feel the pressure, the need to push, I pushed. And within 15 minutes, the baby was out with the help of the midwife and the assistant that was around. Then the sixth question is, what are the side effects with epidural? What are the risks of having epidural? So the first one is low blood pressure. Yes. So if you are a mother, if you are a pregnant woman and you are having low blood pressure, they might discuss an alternative method for painkillers, because low blood pressure does not only affect you as a mother, but might likely affect your child. But for me personally, I wasn't really having low blood pressure, and my blood pressure was monitored constantly while I was on a epidural. So they have to place the blood pressure cuff and monitor me properly, and my blood pressure was within the normal range. So the second is difficulty passing urine. Difficulty passing urine is one of the risk factors. What did my midwife do afterwards? So after the whole labor process and everything, my midwife, they were keeping track of my urine output after the catheter was removed. They just want to make sure that I was able to pass urine, I think within a stipulated amount of time. So they were very much interested in my water intake and also my urine output. But luckily, I didn't have any difficulty passing urine after epidural. Then the third risk that is likely going to be associated with epidural is headaches. You're going to be having severe headache with epidural, and that happens in 1 in 1,000 women also. So in terms of that headache, I remember my anesthetics after the whole procedure came, they were asking me, are you having any headache? And I kept saying no. I just have light headache that just go off when I sleep. Even when I was discharged, my midwives that usually come home, they ask if I usually have this headache, because for those that have this headache, it might last for weeks and it might last for days. That's the third risk factor, or the third side effect. Then the fourth one is increase in body temperature. For me, my temperature was okay. And what do they do afterwards, after the labor? They checked my temperature just to make sure it's within the normal range. And luckily, my temperature was within the normal range. There was no sign of infection, and there was no need to give me antibiotics. And today, I'm still fine. No temperature increase, and I look great. Then the fifth is temporary nerve damage. I did not experience it. My legs were moving. I was able to carry my baby. I was able to do everything afterwards. So it didn't really affect me. Then the sixth is severe complications associated with epidural. I was lucky. I didn't really have that. Then the last one is itchiness and depressed breathing. That's your breathing is being affected. But personally, I did not experience any of the side effects after using epidural. That is just the side effect. That doesn't mean it affects everybody that takes it, but it's a side effect that is likely going to happen. But luckily, I didn't experience any of this. So the seventh question is, what is the impact of epidural on labor? Like I earlier said, I'm sharing my personal experience, not necessarily my midwifery knowledge, just my personal experience. So for me, the impact of this epidural on my labor is the fact that I felt my contractions were delayed after having epidural. And also the midwife actually made me to understand that, okay, there's a possibility of my contractions being delayed with epidural. I spent a longer time on 8 cm, though I got to the hospital at 8 cm. But between 8 cm to 10 cm, the duration with which it dilated was longer than the usual. So I feel there is an impact on contraction when we use epidural. And also the midwife alongside with the anesthetics told me that like when you have epidural, it increases, there's a likely chance of you getting delivered, that's your baby coming out with forceps. They told me that there's a likely chance of my baby getting delivered with a forceps. And that actually happened with my first pregnancy because I had epidural and my daughter was delivered with a forceps alongside with my contractions and all the pushing stuff. So the 8th question is, does epidural affect breastfeeding? For me, it didn't really affect my breastfeeding because immediately I give birth, like I start lactating, my breast milk start coming out. Though my baby did not latch on my breast immediately after giving birth, though they did not suckle immediately after giving birth. So, but there is a tendency that it's likely going to affect breastfeeding in the sense that there are a lot of intervention associated with epidural, and immediately after birth, your baby might not get to the breast immediately. You might be separated from your baby after delivery process, and that might not help with breastfeeding because it is believed that when your baby latch on your breast as soon as possible after delivery, it helps with milk production and it helps the baby and the mom to bond effectively well. The 9th question is, are there any long-term effects of epidural? First of all, there is a long-term effect which is known as permanent nerve damage, but that is rare. It's like 1 in 24,000 or so, but it's rare, so it's not something I was worried about. Then other people complain of long backache, like backache on backache, like prolonged backache after having epidural. But I didn't really have any backache after having epidural. I was fine. And also there might be soreness at these, like the invasion sites at the back, but personally I didn't have that soreness at the invasion site at the back. So these are likely or might be the long-term effects of having an epidural, but luckily I was not having any. Now let's take the number 10 question, and that is, when in labor can I use epidural? Yes, so it's advisable for you not to use epidural at a very early stage or at a very late stage of labor, because if you use it at a very early stage, it might require a lot of further interventions, and if used at a very late stage of labor, it might delay the second stage of labor. So it's just like, use it in between. Don't use it very early, don't use it very late. Then that takes us to the number 11, and that is, where can I have an epidural? Unlike the gasoline that can be brought to your house and when having your home birth, epidural can only be used in the hospital. Epidural can only be used in a place where there is anesthetics to actually put that tube in. So if you are doing a home birth, the likelihood of you getting epidural is 0. Okay, that's the 11th question. Then the 12th question is, can your partner help with the administration of the epidural? What your partner can do is just to help with the positioning and also the emotional and physical support. But the main work is being done by the anesthetics and not your partner. What he can do is to help with the position. Now, let's take that number 13 question. And that is, can I use epidural with any other pain relief? What's the answer to that question? The fact is, when you're having epidural, you see no need for other painkillers, because with epidural, the pain is just gone totally. Yeah, when you just have some epidurals, you have a button that you can use to control the amount of dose. So when the severity of your pain increases, what you just need to do is to press the button and it gives you a dose of painkillers. It is called the PCEA pump, which is the patient-controlled epidural analgesics. So you give the patient, they press the button and they get it. So that is it. It is what it is. Then the number 14 question is, when I'm having an epidural, do I need any other procedure attached? Yes. When you are having an epidural, there are 2 compulsory procedures that needs to be done. And one of it is, guess, cannulation. They have to insert a cannula, not just a cannula, but a working cannula, a patent cannula. They have to make sure that cannula is working. Why are they putting on cannula? Because one of the risks of epidural is low blood pressure, and with the cannula, it is very quick to provide drugs and also fluid if your blood pressure is going down. So if your anesthetic is giving you epidural and there is no cannula, I think that anesthetic needs to be arrested. Then the other procedure that is done alongside with epidural is catheterization. Yes, they have to catheterize you because they are also concerned about your urine output, and you are unable to have that full control over your bladder depending on what is being given. So catheterization and also cannulation are two procedures that is done before that epidural or during the epidural. But putting that cannula should be done before. That one is very compulsory, before the epidural is given at the back. Then the last question on this video is, would you like to have an epidural as a birth plan method? Like as a pain control method, would you like to have an epidural as a pain relief method? Thank you, that's the best word to use. As a pain relief method during labor. So that's the last question. And that question is not for me, rather it's for you. Just drop on the comment section what are your thoughts about epidural. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Messi Mary saying thank you. Bye and see you in my next video.